caring for your pet made easy.
Hello, I'm Dr. Nancy Thomas, and I thought today we would talk about poop, specifically runny poop. Dogs get diarrhea for all kinds of reasons, and most of them are pretty simple. Their digestive systems react quickly to change, so something as small as a new treat, a sudden food switch, or a snack scavenged on their daily walk can upset their stomach. Drinking from puddles, getting into the trash, stress, parasites, or infections can also trigger a loose stool. Because the causes range from harmless to more serious, a telehealth visit is a great way to sort out what's likely going on and whether or not your dog might need hands-on care. During a telehealth appointment, we will focus on the most important details that we can gather through both your observations and what we can see on the video camera. We like to see a dog that we describe as BAR, or bright and responsive. We'll look for your dog's energy level, posture, and overall attitude, since these clues help us to decide how comfortable or uncomfortable your pet might be. We're looking for symptoms of dehydration. We may ask you to show us your dog's gums or eyes, or to tent the skin on the back between their shoulder blades to see if we can assess their degree of hydration. We might have you gently press on their belly to see how tender they might be or if they have a reaction to that pressure. We'll also ask you to describe the stool, how watery it is, how often it's happening, any particular change in odor, if you've noticed mucus or blood. And a photo sometimes can be very helpful to us to help us to sort out what might be going on. We'll ask you about recent food changes, new treats that you have started, any garbage raiding episodes, or anything unusual that your dog might have eaten. We'll ask you about exposure to other animals or environments that are unfamiliar to the dog. We might be concerned about parasites, and if parasites are a possibility, we might ask you to drop off a fecal specimen at your local in-person clinic. At the same time, we're paying attention to signs that the diarrhea might be a part of something more serious. If there's associated vomiting or fever or lethargy, extreme tiredness, or diarrhea lasting more than a couple of days, we may be concerned about things like pancreatitis or liver disease or kidney disease. If we're concerned about those issues, we'll be asking you to have your dog examined in person. By the end of the call, we'll use everything that we have learned from the video and from the questions that we've asked you to determine the next steps. That might be a bland diet, probiotics, medication that you can pick up, or a deworming regimen. If we think something more serious is going on, we will request that you have your pet evaluated in person and perhaps get some blood work or x-rays or ultrasounds or other diagnostic tests. The goal is always the same: to keep your dog comfortable and on the quickest path back to recovery.